In this video, we're going to talk about ischemic strokes. So there are two types of strokes. There are hemorrhagic strokes and there are ischemic strokes. Hemorrhagic strokes have to do with blood in the brain due to a ruptured aneurysm or blood vessel. And an ischemic stroke has to do with ischemia, so decreased blood and oxygen supply to the brain because of a blood clot that has made its way to the brain and is now clotting off, causing ischemia. So what are some risk factors for developing ischemic strokes? Well, so a lot of these have to also do with risk factors for developing blood clots. So patients that have diabetes are at increased risk for developing this because they have vessel damage, and diabetes also raises your lipids, so hyperlipidemia, and so you have increased risk for atherosclerosis, which can cause the plaques to develop in the brain and throughout the body, and as those plaques can always rupture and then move to the brain, or the plaques can grow right there in the brain. Also, smoking closes off all blood vessels and so decreases the diameter, so a small clot can turn into a big clot if someone smokes. Also, the use of contraceptives or pregnancy increases the risk for developing blood clots because of hormones affecting the body. Other risk factors for developing clots in general would be immobility, because when blood's not moving, then it is clotting. And also atrial fibrillation, the blood's not moving out of the heart effectively, and when it's not moving, it's clotting. And so these are risk factors for developing clots. Now, when you get the ischemic stroke, it's not going to be quite as sudden and severe with the big headache like with a hemorrhagic stroke, but what you're going to see is neurological deficits. And so it can affect the left side, the right side, or the whole brain, but some deficits you could see weakness on one side versus the other. The inability to use the left or right arm, the left side of the body versus the right, changes in the face, drooping, changes in speech, changes in swallowing, vision, smells, taste, loss of continence and bladder control. You can have, there's a variety, anything that has nerve innervation can be affected. So you see the symptoms, and what you want to do is you go to the hospital pretty quick, because the sooner you get therapy, the better the chances are that you'll survive and have less chronic long-term complications after the stroke. So they can do a diagnosis, and they can do an MRI or CT, and then they'll see that you have a clot in your brain. What you want to do as a nurse when you have a patient you see they come with ischemic stroke is you're going to prepare to give them thrombolytics. This is the best treatment for a stroke. I say best. For an ischemic stroke, it's what can get rid of that clot and allow the brain to get what it needs. And so thrombolytics, you're not going to give it to patients at risk for bleeding, because what this is going to do is it can make them bleed from anywhere in the body, but the goal is to get rid of the blood clot. So if a patient has an active bleed, a GI bleed, or a history of or any sign that this may actually be a hemorrhagic stroke, you would hold it. But the idea is give them a thrombolytic to break up the clot in the brain and then allow the blood to go where it needs to go. Also, during this time, you don't want to monitor the patient from head to toe, because every organ in the body is affected by nerve innervation. So you may have effects. You may have dysrhythmias, you may have trouble breathing, you may have GI issues. You have to check the patient from head to toe. You also definitely want to monitor the Glasgow Coma scale. If there's any changes in level of consciousness, there may be a worsening stroke, and so you need to know how they're doing mentally. And there's also stroke scales that you'll be following, and you want to monitor their vitals, because your vitals can also go haywire. As far as discharge after all this, the patient is going to probably want to be on anticoagulant therapy to prevent a future stroke from occurring. And then typically these patients are going to have some post-stroke disabilities, so they're going to need physical therapy, speech therapy, maybe some social work, occupational therapy, and rehab to get them to their best functioning that they can, because not all these symptoms completely go away even if they get thrombolytic therapy. So this is a quick summary of an ischemic stroke, or a blood clot stroke.